Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to kick off Season 2 of our podcast series in partnership with Rappahannock Electric Cooperative. It's called We Are REC. Every week we'll release a new episode talking to different people from REC about a host of different topics. We'll get tips for saving money on your electric bill. We'll talk about renewable energy and the impact it can have in our communities. We'll get some behind-the-scenes info about what happens when the power goes out in a storm. Don't miss out on information about community grants, scholarships, REC-hosted events, and more. Get every single episode on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, or on Spotify. Just do a quick search for We Are REC. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Friday of a long weekend as you are listening to the show today. We, however, have pre-recorded it on a Wednesday afternoon, so we're a little bit further away as we're having our conversation on Zoom today from the long weekend, and the people are there listening. But I'm excited about today's show because we're doing something with a little bit of a twist. I've got some repeat guests that are coming to join me on the Zoom screen today. And today's topic is going to be radiotherapy of sorts. It's mental health in the age of COVID-19. Tiffany Markwood and Molly Tahmaseb are joining me on the Zoom screen. They are both licensed clinical social workers with Winchester Medical Center's Outpatient Behavioral Health Services. And you've both done the show with me before, and I have always felt better after we've had a conversation. So I'm hoping that we can spread the joy a little bit today. How do you guys feel about that?
Sounds great. Bring it on.
Yeah, I'm excited.
So I was telling you before we started recording for the radio show that I had reached out to some of my friends to see what was going on with them. How was their mental health? What was going on with their heads? I mean, so many of us have settled into a new normal that probably isn't the normal that we want to be living in right now. And they gave me some feedback on what they would ask if they could have 30 minutes with a therapist. Several of them came up with the concept or the issue they're facing, which is the what if game, that they are struggling. What if I get sick? What if my husband or my kids get sick, or a family member gets sick? What if I lose my job? Can you guys give me some tools and some advice to be able to help them work through and win at the what if game?
You want to start, Tiffany?
Oh, okay, sure. One of the activities that I have been drawn to lately is what I would call the mind dump. You know, when you're faced with all of these questions circulating in your mind, what if, and negative thinking and worries and anxieties and things that are bothering you, just grabbing a piece of paper and something to write with and doing that mind dump. Just get it all out of you and just write it all down, whatever comes to your mind, and then take a look at that piece of paper and kind of read through it and say, okay, of all of these issues and problems and anxieties and worries, what do I have control over? What can I actually fix or change or do anything about? And for all the things that we don't have any control over, just cross them off. Just cross them off. Mm-hmm. And then whatever's left, you can kind of circle those things and say, okay, pick out the top 2 or 3 that are most important to you. And okay, what can you do? Maybe there are little action steps, even though they might be small things. A lot of times we feel better if we're doing something positive about those problems. Maybe it's eating better, sleeping better, going for a walk, sending someone a card, reaching out to someone, just small little acts that can help us to feel like a sense of control or a sense of doing something in the right direction.
Absolutely. These are times where we're all grasping for straws at what we can control. I really love Tiffany's suggestion with trying to pick up what we can control. And if we feel like it's none of the things that we put down, then finding something that we can control. So identify something we can control. So oftentimes when we're what-ifing, we are what-ifing all the negatives. We're not what-ifing the positives, right? We're what-ifing, I get sick, somebody and we don't get sick, my car is going to drive off the road. It's always the big bad scenarios. And so something that we can do and what we can take control over in a way we can reclaim our thought pattern back from those what ifs is taking it to the opposite side. What if the positives? What if I stay healthy? What if I end up getting this project done that I haven't had time to do? What if me and my family all bond more and get closer? So making it the opposite. So what ifs aren't inherently bad. It's just what if about.
And I think sometimes it's so much easier to play the what if game on a negative level because those things always seem to come bubbling up a whole lot faster than playing the what if from a positive perspective. Because when I get stuck in that loop, I'm thinking, okay, I need to start thinking of something positive, but it's really hard sometimes to find something because all of those little things are floating around, knocking the good stuff out of the way.
Exactly. We want to reclaim a piece of that positivity by recognizing that we are doing it and saying to ourselves, okay, this is valid. These are valid fears and valid concerns. Now, how can I turn it around? Because we can't always control our initial thought, our initial reaction, our initial response, but we can control what we do to that and how we follow up with it.
And I think, too, the whole situation that most people are in now where they're maybe working from home, their kids are going to be learning from home at least part of the week in a lot of the surrounding counties. Whereas before, in a normal situation, you would call up a friend, go have coffee, go have dinner, meet for drinks, and just kind of get it out of your system. It's harder to do that now when you are feeling trapped, I guess, inside the four walls of your house.
Yes. One of the strategies I keep going back to during this whole piece of, the things that we can't control, the things we're frustrated, the things we're just tired of, like being inside all the time, is the idea of trying to maintain a presence in this exact moment that you're in right now and trying to dwell there. Sometimes we call those grounding skills, just when you're feeling overwhelmed with the frustration and really your mind keeps filling up with what you're missing out on and what you can't do. Just take a minute to sit and think about what you can do and what you get to do. I have to stay home. I get to stay home. I have a home that I can stay in. I have to do all these things. Well, I get to do all these things. And if you're fortunate enough to have your basic needs met and to be safe, just kind of embrace that moment and breathe and say, right now, I can see these good things around me. I can feel these good things around me. I can smell these good things around me. And maybe walking outside and getting some fresh air, but just kind of embracing the present moment, because we do have a tendency to get really worked up about the future or get really worked up about the past, and we can miss something right in front of us that is okay.
So, Tiffany, you mentioned a second ago that sometimes it helps to do a brain dump and write down all of the negative things that are twirling around in your head. Do you think it would work just as well in the opposite, to write down all of the positive things that you've got going on so you have that list to grab a hold of?
Absolutely. Sometimes we'll call that an exercise of gratitude, or a gratitude list, or a strengths list. What's going well for me right now? What are all the things that I can do that I really like to do and I'm able to do right now? And write those things down and put some energy. And for people who don't like to write, perhaps talking about it, making that a focus of conversation.
I'm one of those people that I think it would be a great idea, but then I overthink it. I have a sticker on my laptop that says, hold on, let me overthink about it. And I would think, I need to do a gratitude journal, but now I have to find just the right journal to write it in. And then I need the perfect pen to write it all down. And I never actually get to making the list because I get so caught up in the minutia of getting to that point.
Yeah, the minutia can be difficult to work around, especially now. Sometimes even I tell people just start it, right? Take a napkin, a piece of paper, the composition book that hasn't been touched for a few years, and start. And if you like it, if you're enjoying it, then think about, okay, maybe I can get this special journal for myself because I'm really following through with it. Because anything that you start doesn't have to be permanent. So we always say, just start where you can and then add to it if you want. And if you need to, tweak it and take away from it if that's the direction that you're going in.
I had asked both of you if you had seen an uptick or a decrease in patients since all of the COVID stuff got really bad. I mean, it's been bad for a while now. And you both said yes. And we're kind of grateful for that because it shows that people are reaching out to try to get some help to work through the issues that they're having.
Absolutely. I feel like people have begrudgingly realized that this is our normal right now. And we were only working under the information we were given at that time. And that who knew by late summer, maybe things would go back to normal. Maybe by fall, things are going back to normal. But here we are, it's September and we're still telemedicine and we're making that work for us. And I think people are just recognizing that this is where the services are going to be. And so they want to access what they can now.
Some of the other issues that my friends raised were conflict related, dealing with people who have different beliefs or different ideas, or people that love the way they're living now versus the people who are just so done with it and they don't understand. Can we take a commercial break and come back and talk about maybe some conflict resolution strategies and how to keep from losing your friends and your family members because they don't agree with you on any of this stuff?
Absolutely.
Yep. Sounds like fun.
Okay, we're going to do all of that in just a couple of minutes. We are on the Zoom screen today with Tiffany Markwood and Molly Tahmaseb. They are both licensed clinical social workers with Winchester Medical Center's Outpatient Behavioral Health Services. It is radiotherapy on the air today. It is Friday as you are listening to it. Of course, we have pre-recorded on a Wednesday afternoon on my son's 26th birthday Wednesday afternoon. We've got a lot to talk about in a couple of minutes. Stay tuned and we'll be right back.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit at NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Friday as you are listening to the show today. We, however, have pre-recorded our conversation over Zoom on a Wednesday afternoon with Tiffany Markwood and Molly Tahmaseb. They are both licensed clinical social workers with Winchester Medical Center's Outpatient Behavioral Health Services. And we talked in the first segment, Tiffany and Molly, about playing the what if game, and you gave us some suggestions and strategies for winning the what if game. One of the other things that some of my friends have been talking to me about is conflict resolution. Now, I will tell you that I have never realized what a little bit of a bubble I am living in my friend circle. A lot of us have the same politics. A lot of us have the same values, and we've raised our kids the same way. We're kind of all doing the same thing, but I've been learning from having conversations with them that that's not always the case for everybody. And they're struggling going out in public and seeing people, for example, not wear a mask when they are very much in favor of wearing a mask. How do you deal with friends and family members that have such polar opposite views and opinions on things when you got to live with them in the same house right now?
This is a good one, and I have a lot of thoughts on this. I mean, on the one hand, I think as much as possible, when you can emphasize what you have in common and look at this person as a whole person, and that regardless of what you disagree about, embrace the freedoms that we're able to have disagreements and we're able to have different ideas, and we live in a place where it's okay to have different ideas. But at the end of that, where we land is that we care about each other as a person and we value each other as a person, and to be able to say things like, thank you for sharing your thoughts with me, thank you for taking the time to talk to me, I appreciate you, and making sure that if we do have a disagreement, that we can end up by expressing care for one another and remembering our personhood and our humanity and what bonds us, because that is stronger than what divides us, even though it may not always feel like it. And I think language is huge. When you start to talk to a person about these things, emphasizing phrases like I feel rather than you should or you are or are not, that makes a big difference, just how you phrase it.
So I shouldn't be saying, what is wrong with you, when I start off these conversations. All right, I'm going to write that down.
People's defenses typically go up when the word should or what's wrong with you come out. Speaking onto what Tiffany said, the idea of also putting in boundaries, I feel like gets totally stigmatized, right? That people don't like boundaries. People don't like having boundaries put up because we take it personally. When in reality, if you feel unsafe going into a situation or engaging with certain people because they're not wearing a mask and you need to wear a mask, or you want to wear a mask, or you feel more comfortable wearing a mask, the idea of saying, I love you, I care about you, and I want to engage with you, but I cannot do that in person unless we wear a mask. I'd be happy to FaceTime you or see you over video or see you over the telephone and offer other suggestions. So it's not a personal thing. It's not saying you are in the wrong for doing this. It is saying that I personally cannot spend time with you in person right now, but I still want to engage with you. Let's find a way to do that. And recognizing that we don't have to take the blame if somebody gets upset about that, because you're not personalizing it. That's, just like Tiffany said, we want to recognize their humanity and recognize that people can be different and that we can still love them for it.
Is it still okay, or is it a healthy way to just realize that you're going to agree to disagree and you just don't bring it up? Politics, for example. I have several friends that are on the opposite end from me on politics, and we have just learned over the years, both of us, we're just not going to bring it up. We're not going to talk about it. Instead, we're going to talk about our kids and all of the other things that we do agree on and have in common. Is that a good thing to do, or is that not good because we're just sticking our heads in the sand?
I think that is an individualized stance that people have the freedom to choose. If you want to enter into a healthy debate with someone because it's enjoyable to kind of go back and forth, but that both of you are able to handle that peaceably and you're able to come back together at the end of the debate, then that's fine. But if you know that you really prefer to enjoy this person's company without that kind of tension, I think it's perfectly okay to just choose to avoid those topics. And like you said, just agree to disagree. We know that we have differences, but we choose to embrace what we have in common and respect each other. And I think that if you're a person who really just wants to avoid the hot topics and the difficult, debates, or just things that you just know you're not trying to convince someone to change their beliefs or perspectives, that just isn't what you're into right now, that's okay, because it can be stressful to enter into that. And sometimes it's good to have like a phrase, kind of a go-to phrase you can kind of practice and just be ready to use that phrase if someone starts bringing up these topics and you're just not interested in going there right now. You can just say, I don't really feel like talking about politics today. Can we talk about something else instead? And just kind of have those phrases ready to go.
It's funny you say that. I have one of my friends, her husband is very animated when it comes to talking about politics, and he does not care who his audience is or where they fall on the political spectrum. And she told us years ago that they have a code word that when he starts getting too wound up about something, she will look at him, and I hope she's listening today because she's going to fall over laughing, and she will look at him and she will say banana. And when he hears banana, it's enough. We're changing this subject now. And so now that we know that, anytime we get together with him, I'm like, so Steve, did you have bananas for breakfast this morning?
It's so important to have that mutual language. And so, when you're going into moments that are often very emotional, it's hard for us to try and come up with something logical. So to have that in our back pocket, that we don't even have to think about it, we can just pull it out and we can say it, and we know what we're talking about and they know what we're talking about, that can be so helpful.
So we've touched on this a little bit throughout the entire show today by virtue of talking about being on Zoom and that we're not really having in-person meetups a lot. What strategies do you have for coping with the antisocial nature of what's going on right now? I mean, I was really concerned when all of this started because I'm out and about and I like going shopping and I like walking around and meeting friends. And I was terrified that this was going to literally kill me. And now my concern is that I have gone so far to the other end that I couldn't tell you the last time I put on a pair of shoes and went somewhere in public with makeup that somebody didn't force me to do. There's got to be a happy medium somewhere. How do you find those happy mediums?
You know, Janet, it's interesting because I feel like a lot of people are finding a different comfort level with things once they don't have to keep this busy persona and this busy life all the time, that they're recognizing, oh, I might like pieces of this, maybe not the extremity of it, maybe not the fact that we're forced to do it, but I like pieces of this. So that almost coming into this new identity is so important. And I always tell people, we've all had to rearrange our plan A's, and some of us are like on plan F's right now. So what we want to do is we can mourn and grieve the plan A. I don't think we just have to brush past it or shove it aside. We're allowed to grieve what we've lost in the plans that had to be arranged or even canceled, but finding a good plan B, C, and D, and even further down, and finding the joyful moments in that. And not comparing the two, because they don't have to be compared. And like I said, we want to mourn and we want to grieve, but we don't want to just sit in that grieving. We want to move forward and say, okay, now that I've had that moment, how can I make my plan B the best plan that it can be?
Do you find that routines are helpful in this? That, because this is where my husband gives me grief, that I got out of the routine of getting up every morning, taking a shower, getting dressed, and leaving the house. Maybe I should go back to that routine, according to him. Now, I don't know. He does have to live here with me every day. But just finding something that is a little piece of what you had to kind of hold on to that a little bit, is that helpful, or do you think that might be hurtful?
I think that's a great question. And I think to determine whether or not something is helpful or hurtful, you have to kind of look at your own personal dynamics and the people around you that you're close with too. But if it's working for you and it's keeping you healthy and safe, then that's working. And some folks really thrive on routine, but some folks really thrive on spontaneity and excitement and chaos. And so they really kind of, don't really want to do the routine. So I think it's really about overall safety and wellness and how you're getting along with the people around you. And as long as you're not hurting those people, of course, you want to listen to them. If they give you some feedback, like you smell funny, then, we want to listen to that. But if you're okay kind of having every day look a little bit different, that's okay too.
And I know that so many of workers now are working remotely. Staff meetings are not being held in the boardroom or in the offices of a lot of businesses now. They're doing it over Zoom. Do you have any suggestions or tips for people that are only meeting together now in groups on a screen instead of being able to joke with each other while they're fixing their coffee before these meetings start?
Not necessarily tips in terms of how to make that more normal, but more moving towards embracing the fact that that is going to be the normal. I don't think we can force normality and get back to where we were before. It doesn't look like that's going to happen anytime soon, unfortunately. But it kind of goes back to plan A would be those jokes around, the water cooler, where plan B is, sending somebody a funny chat during your Zoom meeting, so finding ways that you can make that plan B work for you and recognize that this is where you are. Because if we kind of sit with that 1 foot in, 1 foot out, we never feel fully settled in either world.
And I always go back to, a lot of times you can choose what you think about, and you can think about what you are able to do and be thankful for the opportunities that we have. And of all of the times in, modern history for this pandemic to occur, we have so many technological resources that we can utilize to have interviews like this and to have opportunities to connect with people. And so we can definitely mourn and grieve. And I agree with what Molly shared, the losses that we've had, but it's both and. It doesn't have to be one or the other all the time. We can both mourn and we can embrace the good in what we have and what we have available to us.
And I think sometimes it's just having the ability to recognize it. I know that sometimes having distance, and if you were having issues with coworkers or family members, now you can kind of use this pandemic as an excuse to put a little bit of space between you and that other person to see what happens when you are able to come back. Because sometimes that's all you need is just a little space.
That's a silver lining too.
Absolutely.
My husband would die if I went into the list of people I'm very happy to have space with right now. So we're not going to do that on the air, although I may tell you both when we're done. But before we wrap up, if somebody is listening and they need somebody to talk to, I joked earlier and said that I asked my friends what would they talk to a therapist about if they had 30 minutes. If somebody wants to reach out to just maybe not need long-term conversations with either of you, but they just need to get through a particular situation, how and where is the best way for them to do that? Do they call your office? Do they need to go through telehealth? How does that work now?
They can absolutely call our office and we can assess what they need and point them in the right direction. Absolutely. If they're just looking for something or somebody to talk to for a quick moment, there's warm lines available. The concern hotline that we have here in Winchester is a good option for that. But if they really want something, maybe a therapist, or if they need medication management, even if it's not something we offer here, we'd be happy to talk to them and give them the resources.
Well, I've got at least 3 or 4 more questions that today's answers popped up. So you ladies might have to come back for a regular monthly radiotherapy. Maybe that I joke all the time that when I do my regular shows with Valley Health, that's how I get my health care now. So it seems just kind of normal for me to think this is how I should get my mental health care as well.
We'd be happy to provide you many, many hours of radiotherapy.
Well, we are going to wrap up our conversation today. We have been chatting with Tiffany Markwood and Molly Tahmaseb. They are both licensed clinical social workers with Winchester Medical Center's Outpatient Behavioral Health Services. I'll put phone numbers and links and everything in the show notes page so that you can reach out to them if you need to have a conversation with either of them. And there are plenty of other therapists in your office as well. But Tiffany, Molly, thank you so much for meeting me on the Zoom screen today and having this conversation. Again, I feel better.
Thank you so much for highlighting this much needed topic.
Absolutely. Thank you, Jen. It's always a pleasure talking to you.
And as I mentioned, we have pre-recorded this on a Wednesday afternoon. However, you are listening to it on a Friday afternoon of a long weekend. And if you were really smart, you've already taken the rest of the day off and you've made it a 3.5-day weekend. I hope you get out and enjoy it no matter what you're going to do. I will be back on the air with you on Tuesday, a few minutes after noon. So meet me back here then.